Hello, welcome to Shaka Extra Time. I am Paul Ndiho. Sitting in for Shaka Sally is Peter Clottey, the man from Accra, Ghana, the host and managing editor of Nightline Africa. Hello, Peter.
Hello, Paul. How are you, sir?
I'm great. How is Accra?
Well, Accra is bustling. It's the Christmas festivities all over. So you have carols nights, and a lot of festivities going around in spite of the COVID. People are trying to live their life. They recently held an election that was described as free, fair, transparent, and credible. Although some opposition supporters are displeased with the conduct of the election and called for the resignation of the chairperson of the Electoral Commission. But all in all, it seems the tension has eased and people have returned to normal. There have been a few parliamentary seats that are being rerun, but things are pretty quiet and things are being held in a peaceful environment here. So Ghanaians are looking forward to the Christmas festivities and what comes up during the new year.
I would argue that the feeling is mutual. We are looking forward here to the Christmas festivities, even though we are still struggling with COVID-19. But maybe perhaps on a good note, we've started seeing these vaccines, especially here in North America, in Europe, being distributed, people being vaccinated with a COVID-19 vaccine. Maybe from your vantage point, what do you see in Ghana? What does this mean for people of Ghana, and how can the country maybe tap into some of these vaccines?
Well, some health professionals I spoke with here have hailed the efforts of the president elect who was re elected recently for a 4 year term. They said stringent measures he implemented, including closing the country's borders as well as the airport, because those who were infected with the disease brought the disease to the shores of the country. They thought it was said that the president taking that action prevented a lot more people from coming in to infect more people. They congratulated him for a job well done in terms of how the medical institutions here have managed to combat the disease. Some people have also been critical that there is not enough testing to go around to identify possible infection rate and determine all that. But some people are going about their normal businesses in spite of medical guidelines of social distancing, washing hands frequently, as well as the use of hand sanitizers and the like. Some people are just going about their businesses without even wearing face masks. I remember I went to one of the constituencies known as the Ododo Diodio constituency, the constituency most hotly contested for the parliamentary seat. And those who were standing outside looking at how people are voting were not wearing masks, but they would not allow you to vote if you don't have your face mask on. So those were some of the guidelines that were being implemented that I saw firsthand. However, some people are saying that because of the way the COVID has not really killed a lot of people in the country, some are doubtful of that. So it is a welcome development. Some of these medical experts tell me that a vaccine will be available to treat those people who are, infected with the disease, so it doesn't transmit to other people and affect the young population. It remains to be seen why parts of Africa have survived mightily, because there were earlier predictions that this is going to really affect Africa tremendously. We are yet to see any possible explanation as to why Africa, with a youthful population, has been able to not withstand but have fared better in how they have managed the issue of the coronavirus pandemic, Paul.
Is it about managing or is it about testing? Because there are a lot of critics or pundits out there who would say that I don't think a lot of African countries have been testing testing a lot of people. I think the reason we see cases, a lot of cases here in the United States, in Europe and other countries, it's because there's been massive testing for this COVID-19, as opposed to most African countries where they don't even have the resources to do that.
Well, Paul, you have a point there. Some of these health experts that I spoke with are of the opinion that Africans have been exposed or continue to be exposed to variations of coronaviruses. So they might have been able to develop some kind of immunity to fight against the disease. And because they are usually affected by malaria, cholera, and other coronaviruses, it is fair to argue, they told me, that because they have been exposed to it, the immune system works in such that it's able to combat the coronavirus if they get infected. And that is one of the many reasons with a youthful population. That is why Africa has been able to survive. Looking at the fact that there is not necessarily enough testing going around like some places in the West to determine cases, isolate cases, treat cases. Here, people are going about their normal business. It is establishments where you go to, they tell you if you don't have a face mask, you don't enter. But when you go around places, people are not wearing face masks. Some are doing, others are not. So that is why the health professionals here tell you avoid big crowds, wash your hands frequently, make sure you are properly covered, and follow the medical guidelines, and you'll be fine. And when you get to the airport, you are also tested to make sure that you are COVID negative before you are allowed into the country. So these are some of the measures implemented by the administration that seem to be helping and reducing the number. Although the argument is that there is no capacity to test everybody else to ensure that more cases are determined, or cases are determined, isolation, those infected are isolated and medically treated to be nursed back to health. So let's see how things go. But it is a welcome development with the vaccines approved to be used by some of these countries that we cover judiciously, Paul.
How about the issue of inequality? For example, we've seen here in North America, we've seen in Europe, these rich countries have been able to purchase a lot of vaccines to vaccinate their people. But in Africa, we are yet to see countries that have come forward to say that, oh, we've purchased such and such amount of vaccines to vaccinate our people. There are a lot of critics who said that the West should not leave Africa behind. They should figure out a way to reach out to African countries that cannot afford to buy some of these vaccines and help them in terms of maybe package it as an aid to Africa or to some African countries that can't afford these vaccines.
Well, I've heard those arguments, and I've also heard some African leaders trying to talk about the vaccine and how they can acquire them. Obviously, they might not be financially as powerful as Western countries, but I believe they are working together to try to have the vaccines brought onto the shores of Ghana. I remember some countries are saying that they know Africa has a challenge in terms of being able to compete financially with the West to be able to purchase some of these vaccines for their population. But I believe that hopefully they will find a way of negotiating to get some of these vaccines to treat people who have been affected on the continent. Of course, you know the challenge South Africa has to acquire some of these things. They have been adversely affected by the coronavirus pandemic. They've seen spikes, they've seen the second wave. In some of these countries in sub-Saharan Africa, they are still battling the perception that perhaps there could be a second wave, or the second wave might already be here. So I think they are working with some of these big pharmaceutical companies to try to find out how they will be able to acquire some of these vaccines to treat their people.
Has the government of Ghana, for example, put any measures in place to purchase these vaccines, or have you heard from any official? If they have, how are they going to distribute it? Because the logistics are behind the distribution of these vaccines is kind of very difficult, in a sense that in some places they require uh, deep freezers, temperatures of 70 below 70 degrees to make sure that the vaccine is kept at that temperature. How many uh, countries or how many places in Ghana can afford to do something like that?
The president addressed the nation talking about measures they've put in place in terms of acquiring the vaccines and how it will be distributed. So they are quite handling it. The government is going to give out a more detailed version of the measures they are putting in place in terms of purchasing the vaccines and how they are going to distribute it. So we are waiting to see the detailed plan the government wants to carry out in order to protect the population in terms of the fight against the coronavirus. So far, what they have done, some of these health experts have praised the efforts of the government in terms of how it has managed the global pandemic here in Accra. So let's see when they come out with the plans what it will entail and how they want to strategize to have all these necessary equipment needed for these vaccines to be used to protect life and property here in Ghana.
How would you respond to critics who have said having these vaccines is a welcome idea, but the fact that the COVID-19 vaccine global access or COVIX initiative, there are a lot of people who say Africa has every reason to worry, simply because this initiative is supposed to give them free drugs, but at the same time, they are also competing with countries that have a lot of resources at their disposal.
I understand. That is why a lot of health experts are encouraging government in the sub-Saharan African region to join forces, because once they join forces, they pull their resources together. They will be able to have the financial muscle to be able to purchase some of these vaccines to help their people back home. And I believe the governments in the regions are working together. They are talking to each other. Let us give them a little time to see what comes out of the talking that they are doing, the negotiations that they are doing, and see the next steps forward. Because as you know, they are mandated by the Constitution to protect life and property, and those are the core duties of government as enshrined in their respective constitutions. So it works out well for them if they will work together as one, pool their resources, and be able to compete effectively on the global stage by the vaccines to protect their own people.
Earlier, you talked about people trying to wear masks, wash hands, but we are talking about a culture here where people are very, very free, really. We interact with each other, we eat from the same plates, in some cases, we sleep on the same bed. You find two or three people sleeping on the same bed. How is that playing out?
Well, that is a very important distinction you've made. And I have been to a few places, I've been to certain institutions, and I was reading about a church that has stopped people from even having worship because it's part of the strategy they have implemented. They have only very few people who speak without mask, but everybody in the church has to wear mask. Now, at home, I visited a couple of people where at home they are not wearing the mask because they anticipate that people they are living with are not exposed to it. That's a dangerous thing. But I also saw that when they were going out, they all wore their masks. So those are the dynamics that I see. Others don't care so much because some of them will say, show me somebody who has died as a family member from COVID. And those are some of the things they argue about. Some of them don't believe that it is real. Others are also saying that they have the vaccine as youth to fight it. So there are misconceptions out there. But I believe that education campaigns that were launched since March appear to be working because some people are taking it very seriously. I remember I saw somebody trying to board an Uber, and when the Uber came, the Uber driver was not wearing a mask. This lady refused to board the Uber car because the driver was not wearing a mask. I in fact, insisted that the man wear a mask. The man said, well, I don't have a mask. I'm going to pull all the windows down. You wear your mask. You'll be fine. She said, nope, I'm not entering into the car until I'm not boarding until you wear a mask. So the guy left and she ordered a new Uber. The new Uber came. The guy was wearing a mask before she boarded that Uber car to leave. So these are some of the dynamics that I've seen here. Some people believing that this is a dangerous disease that they need to protect themselves against, and others are saying, well, we don't care. We are youthful. Our immune system is strong. We'll be able to fight it. So these are the dynamics that I have witnessed here in Accra.
In fact, you bring up a very good point, the issue of accessibility and affordability. There are a lot of people who can't afford to buy those masks. There are a lot of people who can't access those masks. A lot of people who can't afford to wash their hands every time they're going to eat a meal or touch something. How are health officials responding to those kinds of challenges?
Paul, it's interesting to know that when you've been to Accra before, you see that a lot of hawkers hawk in between cars when you are driving in certain strategic parts of the city. Now, what I have seen is that people are selling boxes of these face masks, and they are even selling it one by one. So you can even purchase a single one, or purchase a box, or purchase as many as you can in the street. So it has become so common that people can purchase it. Perhaps people in the rural areas are those who might not be able to afford it. And of course, there are some poor people in Accra too who might not afford it. But a sizable number of people appear to be able to purchase them. I've seen some people board the mass transportation and they are wearing it. Others bought it and they are not wearing it. So it's an interesting dynamic, Paul. Let's see how things pan out.
How about the issue of implementation?
You cannot enter a bank without a face mask. You will be booted out. You cannot enter an establishment like the saloon or even the go to a restaurant. They will tell you no face mask, no entry. It's just plastered at the entrance before you get to that establishment. You can't go and buy phone units. You know how you buy phone units to top up on your cell phone to make calls and receive calls and use all kinds of your apps. If you don't have those face masks, they will refuse to give you or render service to you. So these are areas where enforcement can be appreciated. However, in everyday life, it is very difficult to tell somebody to wear masks because they might insult you that they don't believe in it. But it is when you have to get services rendered to you that you will be compelled. That because if you don't have the face mask, you will not, they will not give you a service at all. They will not even entertain you or allow you to enter the establishment.
Earlier, you talked about Africa having a youthful population. You also raised the issue of immunity, that people have dealt with uh, some of these epidemics like Ebola, like HIV and AIDS. So along the way, people have developed some kind of immunity. But there is also a school of thought that says that if it wasn't for maybe African leaders standing up in the early days of this pandemic and saying that no, we are going to shut our borders, no, we are going to close our economies, close our countries from external intrusion or intruders, things could have gotten out of control. In fact, I think you also alluded to the fact that the president, your president in Ghana, was commended for having risen up to the challenge at the beginning of this pandemic. And to his credit, that's why very few Ghanaians have died as a result of this COVID-19.
Yes, Paul, Africa battle a lot of epidemics. The recent one is Ebola, and then you have other diseases that Africa battles all the time. So, with that being said, they have the experience to take immediate action, and the population is aware of some of these epidemics. So when something like this global pandemic happened, it was easy, relatively easy for these governments to take drastic action to protect the population. And it's one of the reasons why health experts say that infection rate appears to be down or appears not to have adversely affected the population in Africa than in the West. So it's based on experience. The skills and knowledge acquired during these epidemics that are used, by extrapolation or by the experience they have to use in combating the coronavirus. So these are some of the things the health experts are telling me that is working in favor of Africa because Africa faces pandemics quite often. So they have developed experience. They know what to do at certain time. They know what not to do to combat issues of the epidemic. So that is what informed some of these decisions African leaders took when coronavirus started aggressively in March.
Let's go back to the issue you also talked about, the issue of misinformation. There is a lot of misinformation about the coronavirus, about this pandemic. There is so much, especially on social media, there is so much misinformation surrounding these vaccines that are being used out here in the West, in Europe. We see a lot of misinformation surrounding those vaccines. If you were to look at some of, let's say, the misinformation around polio, around Ebola, and other diseases that have killed a lot of people, how should governments, in your view, maybe go around this coronavirus and misinformation?
Education, education, education. And that is one of the things I have seen in some of these African countries we cover. That, especially here in Accra, on TV and on radio, even when you get to the airport, there's this blast of giving ready information to the population. And you have health experts, you have government communication officials all involved in this. And you have, at that time, the president religiously going on the air at certain specific time of the week to communicate or give a speech to the nation about efforts his administration was making to ensure that they combat this disease. So the education, I think, has been effective. Of course, there are some doubting Thomases. Of course, there are some people who will not believe it. There are misconceptions, misinformation, and some people try to dilute the whole thing. But that should not preclude the government from going ahead to educate the masses because it's part of its core duty to protect the people. And so if that is what it takes, then you need to go the extra mile to get it done. Of course, there have been critics who say the government has not done enough and that the government should have taken drastic measures from the very beginning to prevent some of these happenings or some of this death, because they accuse the government that one death from the coronavirus is one death too much, or too many, and that is why they are being critical of the administration. Some health experts have praised the administration for the drastic action it took in terms of closing down the borders and preventing planes from coming in, to get it acts together, let the wave pass, treat those who are infected before allowing people to come, and putting in stringent measures to ensure that before you get or arrive in this country, you should have a COVID-19 negative test before you get here. When you get here, you will also be tested again by the authorities here. If you test positive, they will not allow you into the population. They put you aside, pull you away, keep you somewhere for 10 to 14 days before they allow, if the coronavirus issue is resolved, before you are allowed into the population. So these are some of the issues that have come up and the government appear to be working on.
You also talked about the second wave, and I've been reading a lot of stuff in relation to the second wave of coronavirus. Should governments close their borders again? Should they shut down their economies? When you look at what happened when most countries closed down, there was even a more potent virus, the hunger that came along with governments shutting down their economies. Most people live hand to mouth. They had nothing, absolutely nothing to eat. So as a result, more people died of hunger. Should governments consider shutting down their economies when they're hit with this second wave of coronavirus?
Well, Paul, I put the same question to some health officials here, and they were saying they don't see it happening, particularly when the economic impact of shutting down all business activities were enormous, and some economies have shrunk. And so now that they know the disease, now that they've come to know how to manage it, now that they know that they have educated the population with a sizable number of people respecting the medical guidelines in terms of face covering, wearing a mask, in terms of frequent hand washing, in terms of not rubbing your hand on your face, in terms of using hand sanitizer if you don't have access to running water and soap to wash your hands and all that. So they don't see any of these African countries shutting the economies down again, uh, particularly seeing how they were affected by the first shutdown of the economy, their economies contracting, people losing their jobs. Some of these jobs are not coming back anymore, and all that. So Africans have known how to manage it well, and because the coronavirus has not really killed people, as many people as originally anticipated, they think they pretty much have a fair control of the situation and that they'll be able to handle it while the economic side is also working, Paul.
How about the issue of stigma? Are people stigmatized when you say, oh, so and so had COVID? Do you interact easily with your neighbors, your friends,
That is the strangest thing, the issue of stigmatization. I'm yet to see the stigma aspect play out, because I have spoken to quite a number of people who have recovered and they don't have any problem at all. Actually, one of my juniors at the university recovered from the coronavirus. So everywhere he went, he made sure he has his covering, and he's been preaching to the people that you better wear your face mask. I don't want to be infected again because I lost my smell. I couldn't eat anything. I lost my appetite, and things were difficult. So now he's an apostle, if I may put it that way, trying to preach that, look, this disease is real. It's very negative. It affects your whole system. Don't get to where I got to. So yeah, these are some of the things that are happening here in Accra, Paul.
I guess we need more ambassadors like your friend Peter. Thank you so much for your time.
Thank you, Paul, and enjoy the rest of your day.